How do I know if I have a hypotonic pelvic floor? Imagine trying to hold back a sneeze or cough and noticing that your body doesn't quite respond the way it used to. That's a clue that your pelvic floor muscles might be weaker than they should be. If you're curious about whether your pelvic muscles are too loose or weak, there are some signs to watch for. One common sign is leaking urine when you cough, laugh, or exercise. This is called stress urinary incontinence and happens when your muscles can't support your bladder properly. You might also feel like your bladder is never fully empty or need to go to the bathroom very often, which can be a sign of weak pelvic support. Some women notice vaginal laxity, which means feeling less tight or sensation in the vaginal area. This can lead to feelings of pressure or heaviness in the pelvic region, sometimes described as a bulge or feeling like something is falling down. Pelvic organ prolapse is another sign, where organs like the bladder or uterus drop lower into the vaginal canal. Lower back pain or discomfort can also be linked to poor pelvic support. If you find it harder to achieve orgasm or notice decreased sensation during sex, weak pelvic muscles could be part of the cause. These symptoms tend to become more noticeable during pregnancy or after childbirth because the muscles are under extra strain. Activities like running, jumping, or lifting heavy weights may make these symptoms worse if your pelvic floor is weak. If you experience any of these signs regularly, it's a good idea to pay attention to how your body feels during daily tasks and exercise. A healthcare provider or pelvic floor physical therapist can do a physical exam to check your muscle strength. They might ask you to contract and relax your pelvic muscles to see how well they respond. They also look for signs of prolapse and assess your overall pelvic support. Understanding your pelvic floor health is especially important if you're pregnant or trying to conceive. Strengthening exercises like Kegel exercises can help improve muscle tone and support, but only if your muscles are truly weak. Doing them incorrectly or without guidance can sometimes do more harm than good. If you're unsure about your pelvic health, working with a specialist can give you a clear diagnosis and a personalized exercise plan. Remember, if you notice leaking, pelvic pressure, vaginal laxity, or decreased sensation during sex, these could be signs of a hypotonic pelvic floor. Addressing these issues early can make a big difference in your comfort and confidence.